Welcome, dear friends. Welcome to my channel. As we have been discussing about the clinical case study approach, this is the sixth clinical case which we have taken from the upper limb. Yeah, as the curriculum has been changed in India by NMC, the questioning pattern is also changed. So when the first year to the final year students, when they try to see the examination, they are going to see the clinical condition, and from the clinical condition, they are going to see the questions. So a student must understand the clinical condition. After that, then only they can write the answers. Now, not only seeing the questions, not only studying the questions, the student must understand the clinical condition. So when the student can understand it, when the student study any topic completely, then only he can understand the condition and try to answer to the questions. Now this is the clinical condition which you're seeing from the upper limb. We'll discuss from first upper limb, then after that we'll discuss other regions. Now let us see that this is the first question and this is the first clinical condition. A 54-year-old woman visits hospital after she detected a mass in her breast. So this is one condition. So that's how we have to concentrate on that particular symptoms. Okay, so the first symptom the patient has observed when she was doing self-examination, right? A mass in her breast. Now second symptom, the physician, so she went to the hospital, then the physician also detected the mass in the left breast. Try to observe that. First, she has observed when she was doing her self-examination, she has found some mass in her breast. When she went to the hospital, the physician detected a mass in the left breast. And the physician ordered a mammogram, as you know that. So for the mammogram, they just like an X-ray, they just go for that. They can see that any lumps or any mass is present in that breast, where and the which extent it is occupying that you can see clearly in the mammogram. Next one is the results of these studies showed a solid mass. And next one is the biopsy of the mass revealed the carcinoma. So they found the mass in the breast. Then they have confirmed it a solid mass. Then after that, they have gone for the biopsy, and the biopsy results also came. They can see that the result is carcinoma. Now she underwent mastectomy, so removal of the breast gland. After that, and thereafter, she recovered well, very good. So the patient undergone mastectomy, a removal of the mammary gland, the left breast gland. Then after that, what happened after that? She was recovering, but after a couple of weeks, she experienced weakness in her left shoulder. Observe this symptom, weakness in her left shoulder. There is one complication, you can see that. The next one, and had difficulty in raising her left arm. So what she could not able to do, weakness in her left shoulder, and she is not able to raise her left arm above her head. Okay, up to some extent she can rise, but above the head she could not rise. Then during her next visit to the hospital, the physician noticed her left scapula was protruded. Left scapula was protruded posteriorly. Okay, see at a great extent than on her right side. Based on the knowledge of anatomy, be able to answer the following question. This is the condition. So, what are the conditions? What are the symptoms? And what are the conditions you are seeing? First, mass in her breast. Very good. Then mass in the left breast. Mammogram. Then solid mass, and it is confirmed as carcinoma. And she underwent mastectomy. Then after that, she was recovering. After some time, 2 weeks, what happened? Weakness in her left shoulder, then difficulty in raising her left arm, then after that left scapula was protruded. So these are the highlighted words you have to concentrate. So when you're studying any condition, you have to observe keenly the symptoms, what are the complications, then you can analyze it and try to answer that. Let us see the questions. So first question is, name the lymph nodes receiving the lymph from the different parts of the breast and locate each group. So This you have to draw the diagram and write the lymph node. I will show that. Then the second question is, what is sentinel node biopsy? What is sentinel node biopsy? The next one is, what could be the cause of difficulty in raising the arm above the head in this patient? Let us see one by one. So the answer, sir, as you have discussed the first question answer, all the different types of lymph nodes you have to, this diagram you have to draw, and you have to mention each and every group: anterior group, posterior group, lateral group. Then after that, the apical group, central group. These are all the lymph nodes you have to draw, and where they're from which part they're draining. Suppose skin is drained from from the skin, the lymph is drained into which lymph nodes, that you have to draw, that you have to explain. Then even from the parenchyma of the breast, lymph is drained into which lymph nodes, from which lymph nodes to which lymph nodes they are traversing, that you have to write. So all these things you have to write. Then after the parasternal group of lymph nodes, that you have to explain. So each and every group of lymph nodes you have to explain. The second question is sentinel node biopsy. What is the sentinel node biopsy? Sentinel node biopsy is a hypothetical first lymph node or a group of lymph nodes draining a cancer. So in case of carcinoma of the mammary gland, the anterior axillary group is considered as sentinel. What is that? Anterior group of axillary nodes are considered as sentinel nodes. So for confirmation of diagnosis, these group of lymph nodes were considered for biopsy. So where exactly this anterior group of lymph nodes are present? So they are present over the serratus anterior muscle fibers. Serratus anterior muscle fibers. So that is about the sentinel node biopsy. So the third question is the difficulty in raising the arm above the head. So overhead abduction at the shoulder is due to the paralysis of serratus anterior muscle. Now, you need to understand where exactly the serratus anterior muscle is present and what happened. Yeah, this is the picture which you can identify. So the upper fibers, so the upper 8 ribs are giving origin to the serratus anterior muscle fibers. So on the serratus anterior muscle fibers, we can identify the anterior group of lymph nodes, that is sentinel group of lymph nodes. They can be seen that. So during the biopsy or perhaps during the mastectomy, the surgeon must have perhaps he has damaged the long thoracic nerve. Can you see here this white colored nerve which is present here? So this is the nerve called as long thoracic nerve, which is supplying to this serratus anterior. During the removal of this mammary gland, the surgeon must have damaged this long thoracic nerve that is causing that winging of scapula, and also the patient is not able to lift her arm above the shoulder. Okay, so the nerve to the serratus anterior was injured during the removal of axillary lymph nodes. Which lymph nodes? Sentinel group of lymph nodes. So that is the answer for the third question. So this is how you have to understand the condition. After that, then only you have to try to answer to the questions given over there. Thank you. See you soon with a new class.